Welcome back, everyone, to our NHS podcast series featuring Andy Kinnear and David Kwo, both digital healthcare consultants and former CIOs in the NHS. In our first episode, you both shared a bit about your background and how it led to you working with uPerform. Now, I'd like to talk a little bit more about the current state of the NHS, what it is doing well, where it is falling short, and what other challenges surround its digital transformation effort. Andy, you've mentioned a few times in our personal conversations the Darzi report. For our listeners, could you explain a little bit about what it is and why it's relevant to this conversation now?
Yeah, sure. So the Darzi report is a shorthand for a piece of work commissioned by the government and led by Lord Darzi. Essentially, we had the general election in our country in the summer, and in June we saw a new government, a new change of flavour. A new government came into office and commissioned a review of where the NHS was at. And Lord Darzi led that work. A really startling sort of rapid turnaround piece of analysis. From commissioning to publication was less than 10 weeks, really quick. And it's a fairly depressing read, in truth. It sets out an NHS that's largely broken, or certainly fairly damaged. It's in a really difficult place. Lots of clinical pressures, lots of waiting list pressures. A lot of people waiting a long time for treatments, things like that. A workforce who are exhausted, but also feel a little bit ignored and not listened to and not particularly loved. Really a long description of, without being too political about it, a long description of the fact that as a service that's been underfunded for over a decade, then this is not an overnight kind of problem we've created. It's taken a long time to create, and it will probably take quite a long time to remedy. But I think what is interesting is that he then begins to point towards the potential solutions, and and technology being very much seen as one of those. So I think for those of us who work in the digital health space, I would say, somebody said to me one day, is Darzi the sort of green shoots? And I said, well, I don't think it's the green shoots, but it's definitely the seeds that are now going to germinate and create the green shoots. It's the beginning of what could be quite a positive phase.
Yeah, I mean, I just like to add to that by kind of elaborating on some of the specific areas that are looking for NHS reform. And so, yeah, I think the current, the next chapter in the Darzi report is a 10-year plan that the government's due to issue next May on the back of that report. So if you like, that report called out, all the problems, but that signaled a set of real reforms and changes that are due to be set out in this 10-year plan next year. And we've now recently had information about how that 10-year plan is going to be developed. They've already established 11 working groups that are working busily now under various topics to inform that 10-year plan. And just to give you a flavor, they include working groups on prevention, on improving quality of care, on improving integration of care, so more joined up care, particularly for patients with long-term conditions, more equitable distribution of care and access. But then also other specific areas. One working group there to do dedicated on digital data and technology, and another one on productivity and so forth. And so a lot of people around this industry, like Andy and myself, are now trying to get to particularly the digital technology working group and try to give them the benefit of our own thoughts and recommendations. And for me, and from my particular corner, I work with a group of clinicians and CIOs that are particularly interested in integrated systems for integrated care. And our particular vision, which is actually shared by a member of that working group, it so happens, they're a part of our group, is about the next generation of EPRs. So the next generation of EPRs we expect to see in the UK is to see EPR systems that work across care settings. So not just in acute hospitals, but also in primary care, in mental health, and in social care. So one system across all the care settings. And we believe that's the only true way to deliver integrated care for patients. And the reason I think that's important for uPerform is that I believe this will expand the use of uPerform. So in the same way as you've worked closely with Epic clients in the United States who are by and large focused on acute and tertiary care, just like in Scandinavia and in the US and Canada. I believe that in the UK, the focus for digital will be across care settings. And in fact, there are not many, but a few integrated care systems or geographical areas in the UK that are actually going out to the market, going out to procurement with single EPR systems that cover primary care, acute, community mental health, and social care, which is, in a way very innovative for the UK, because we've been all kind of fragmented and siloed, because organizationally the NHS has been fragmented and siloed. But that's now changing to integrated care, and we're excited about that from a digital and clinical, pathway point of view. But I think for digital companies like uPerform, I think that holds great opportunity and should open up, a whole vista of new customers from other care settings who I think will benefit from learning how to use these new integrated EPRs more efficiently and effectively.
Okay, do you know what, David? I couldn't agree more. It's funny. I spent a decade working in the shared record space, trying to join together siloed EPRs that were in acute or primary care or community or mental health and so on and so forth. And I suppose I saw two things that, kind of one good and one bad, I suppose. One, the good thing being the prizes, the prize we are chasing if we succeed in joining that record across that system in the way you've described is immense.
Right.
The sort of opportunity to deliver better services by having proper coordinated care where our clinician at any point on that patient journey has got access to the right information about that, that patient that's in front of them is a huge one. And I think the second thing I saw was the degree to which we are letting down our public at the moment by not having that. So every time there's a handoff between one organisation and another, there's a blurriness around the care that then gets provided. There's a frustration for the patient and their family in that moment, and a frustration for the clinician because they're on the receiving end of not being able to, do the job in the way that they'd like. So, I genuinely hope this agenda pushes us much more towards those integrated care record models that you're describing, because I do think there's great prizes for the public of the UK in that.
I think that's absolutely right, and I would also add, just to reinforce what you just said. So the patient point of view and patient engagement is absolutely critical. The Darzi report highlights that, and I heard an interesting statistic yesterday, which I think is relevant, where I heard from a GP that there was a survey in his area which found that 57% of patients in his patch thought that the NHS had a single system. Okay, so which is, if you think about it as a patient, of course you would think that, wouldn't you? Why would you as a patient think that your record is separated between hospitals and GP practices? Okay, but it is, and it's a secret that it's not a fact that's not publicized. But anyway, so I think that so I agree with you, Andy. I think we are. I think hopefully we are progressing. I hope that these tools will get better for our clinicians and for patients, and that's going to require. It's going to require the usual things for good adoption and implementation, good resources, good leadership, good tools, but good digital tools there, I think, has to include good training support tools like uPerform, because I guess if you look back, we haven't been doing digital training very well in the NHS. I wouldn't have said we were stellar, or a leader in that area. And I think if we're gonna kind of lead in the digital area in some way, we want the right training support tools to be there right alongside us.
Definitely.
I love that you guys are bringing up this integration piece. I just recently read and did a little write-up on the class research report on integration, and how when it comes to EHR satisfaction here in the US and EPR satisfaction, it's actually the number one missing piece from the clinician's point of view. They still feel like they're not getting that simplification of sharing of patient information, whether that's even within the same system. So even if that's like from my own ambulatory clinic over here, and at the end of the day, a ton of that does come down to the training on the tool that's available. And so while there is this burden that needs to be put on the technology vendors themselves to design and deliver great integration technology, I would argue that the burden on the system, the health system or the trust, to then have really great governance around those tools, and the training piece cannot be left out. It's complicated to share data. It's not as simple as like, I just want to see this view of my patient from over here. It has to be one governed and set up and implemented correctly. And then there has to be really great training. And we've seen that even among our clients, where we've seen the ratings from the end users after utilization and implementation of uPerform, where they're now saying that, mHealth Fairview saw a 12% increase in their agreement that external integration is sufficient. And that's a metric that's really hard to move. And so we can see and we can track, and we have the statistics that show us that improving training can actually improve how they feel about integration. And so I love that you guys brought this up as a key, metric for the NHS moving forward. Is how do we deliver great patient care by making sure everyone has the same information, because I'd say we're a global economy, but really, I mean, within the UK, you don't have to travel very far to be in a different trust. And so, if you're out on a holiday and you get sick, you want to know that your information is going to be available to the clinicians who are treating you, no matter where you are.
I think, Liz, we have, in that space particularly, I think we have made some good progress, but we have two distinct advantages, I think. Firstly, we're not in a competitive health delivery environment like you are in the US. So our organizations ought to not be worried about sharing patient information as if they were sharing customer information, and therefore likely to lose business as a result. So that barrier doesn't exist for us here. And in theory, at least, that ought to make some of that sharing more easy. The other thing that we've done is most communities, many of the geographies across England at least, have implemented a level of shared record program. So that might well be a layer of software that sits above their existing EPRs, their existing siloed EPRs, and shares a certain amount of information. And I was heavily involved in one of those programs, and I understand it deeply. I think what their great legacy isn't really the software architecture they've delivered, although that, in some areas that has been genuinely impressive. I would say it's been more the fact that culturally we have already educated our clinicians that this is possible and it's okay and it will be safe to share this information. So, dear GPs, you can actually trust the doctors in the hospital with this information. ED, you can trust social care with this, and so on. So I think we've moved quite a long way culturally, certainly compared to countries in Europe and I suspect in the US. We're in a relatively good place. That said, it still feels quite clunky, not very slick thing, certainly not the slick model David was alluding to and sort of describing we'd like to get to. But I think we're in a good place to make that leap. And as David said, I agree 100%. We're going to need a tool set to help us do that, and including an investment in the training to support it. So it feels like it should be doable. But you know, the NHS does like to snatch defeat from the jaws of victory occasionally. So you know, time will tell whether we actually make it happen or not.
And I think that's a great point you make around culture, because as we all know in this business, it's not really the tools; it's about people is the biggest challenge. And so I really get your point that, you know, getting clinicians or providers across care settings used to the fact that sharing information is normal and a good thing. I think that will be a very helpful stepping stone towards you know, true digital integration, which is not just integrating the data, but integrating the functionality. Because, you know, we're talking about long-term conditions, we're talking about complex pathways, patients with multiple complex pathways, which can only be supported by deeply functional EPR systems working across care settings. And that's all about, you know, clinical processes enabled by digital, which will require you know, complex tools and the training and getting to know how to use those tools quickly. And so I think, you know, I think we're all agreeing here that it's going to be, I think there are some potentially great opportunities coming up and starting in the next, you know, few years for uPerform.
Right. David, Andy, thank you as always for your insights there. It's safe to say that there are plenty of things the NHS is doing well. However, it's also clear that there's still a lot of room for improvement. In our next episode, I'd love to talk some more about strategies the NHS can employ to drive meaningful change and where uPerform may or may not fit into that effort. Thanks again.